Assalamu alaikum. Dr. Hussain Bashpolachi YouTube channel is with you, and we are discussing the West Asia War and in the context of previous Iran and Iraq war. What was the medical professionalism in that war, and what is experience of the Iran, and what will be happening in this Iran, USA, Israel, and a multi-country war. But basically, the war is on the Iran. And let us see how the healthcare system of the Iran is resilient and what they have done during the Iraq war and what are the memoirs of those medical professionals, doctors, nurses, and they are still in Iran. So the latest research published in the archives of the military journal or Journal of Archives of Military. Uh, so we will discuss that research paper also, which has a memoir record of 110 medical doctors and nurses during Iraq and Iran war, and what was the field scenes as well as the tragedies and observations of those medical or healthcare providers, HPV, healthcare, HCP, healthcare providers. And today's context is that it is 13th day and still the war is going on, attacks are going on, and Tehran Hospital, other 14 hospitals as per WHO. And in Iran, there are 400 hospitals and 200,000 doctors, and their equipments and other uh, supplies are also uh, disturbed, and the Strait of Hormuz is causing a blockage, which is also causing the supply line of the medical supplies, medicine to the Asian countries, including Pakistan, and even towards the Iran also. This is an important trade route of the Indian Ocean, one of the fastest trade route of the world. And how the doctors are feeling and going. We will give you some pictures and glimpses, but let us move to the presentation uh, of so this is sharing of the presentation, and let us start from the first slide. You can see that the first slide shows that how this is going on, um, Iran and Iraq war, and we will give you professionalism of healthcare job, U.S. Israel Iran war memoirs from the Iran war, and what are the lessons which we can draw. The article was published by Zara Farsi. She's a PhD and working in the University of one of the University of Iran and Department of Community Medicine. Her email is also available. And Journal of Archives and Military Medicine, issue February 5, 2027, and this is a research article. The background is that the professionalism is an important characteristic of every service career. Professionalization is a multidimensional concept, and depending on the time, context, and discipline, has variable meaning. Today, development of educational standards or education standards and professional certificates has led professional jobs such as nursing and medicine to move to professional status. Nurses, physicians, and other healthcare professionals provide medical assistance and humanitarian aid in conflicts owing to their specialized knowledge and skill and their expected duty to the society. So they are performing basically a duty of the society. This is once again the reference. The Iran-Iraq war began in September 2018 and ended in August 1988. So you can understand that it was 8 years during the war. Iran healthcare staff as well as combatants experienced many difficulties and their efforts not secret for anyone. Medical staff tried to treat the wounded during the war, and they were not safe from the war injuries. This is important. So in this war, at least 25 medical personnel have been injured and 4 killed, and almost 14 health center and hospital have been attacked by heavy bombs. One of the conventional bombs known in the present history. So 400 Iranian doctors, nurses, paramedics, and rescue workers were killed in the war. So they have a background of sacrifice not only of the patients, but they have experience of 4,000 Iranian doctors and nurses, martyrdom or death or shahadat. So the doctors and the Iranian healthcare system is one of the unique deal with the battle situation, and they are really a brave people. So this is a present picture from the Iran. A survivor of the war is being treated in the Tehran hospital. The paper says that the study was conducted to explain the role of Iran-Iraq war in the professionalism of healthcare discipline. Based on the documented experience, designed in this part of the qualitative study, which used the conventional content analysis during, this is a new method of the qualitative 2014-2016, the study population consists of healthcare professionals who had taken care of veterans, wounded, and martyrs in the Iraq-Iran war. So almost 110 and published memoirs were selected, and almost 900 pages of the memoirs were scanned and analyzed, and paper is based on these memoirs. Uh, so this is the theme and sub-theme. You can see training and learning was there, learning when caring of the woman, wounded was there, discover the dormant forces in the human evolution of the doctors over the time. And these are also the themes and sub-themes: poor health condition, high workload, severity of the injuries, action, high speed operations, observance to hygiene, triage, under control condition, holistic support, expression of trait. These were the sub-themes which came out of this study. Then the interpersonal relationships of the staff, cooperation among the staff, morality, cardiality, spiritual influence, and relationship therapy. This is a new term which I have learned from them. So they even disclose to the family and call it not breaking the bad news, but they call it relationship therapy. Sublimation of the spirit, loss of materialistic dependence in the front, escape from ordinary life, a feeling of inner satisfaction, sublimation spirit. So these were the first doctor treated the wounded in small tents and bunkers. But over time, Iran front line has, this is an important paragraph, and I think at first doctors treated the wounded in small tents or bunkers on the front line. Naturally, many injuries were martyred because of the lack of skilled doctors and medical. But over time, Iran front line has with the strongest emergency and field hospital in the world war. So you can understand that in this contemporary world, the strongest emergency field hospitals, and frontline health workers, best of the best are with the Iran. So, and the purpose of the strength of the Iranian people, resilience in the war is because their healthcare system, doctors, they are not only skilled but brave, and they have 8 years experience of another war, how to deal with these emergencies. So that was the bottom line or punchline, and we are moving fast. Sometimes use the experience indigenous people such as removing of the sticky material from the body of the wounded with water pressure. So that was a folk wisdom or folk wisdom. The local cooperation. Uh, Wood heater was another creation of them. Desert bathroom was the creation. So you can understand that how the hospitals and the doctors are integrated and deeply rooted. And they also have the rural style of rural people to solve their problem. The villagers had heaters operating with wood. We brought 2 barrels from the camp. We cut them by the bayonet and made something like heater of villagers. The heater actually worked great. So these are the few memoirs which I am sharing, and we are moving further. That medical team as a field troops. The army, the guideline is mentioned that clinic tents can be set up in 30-kilometer battlefield, whereas in the wartime emergency tents were set up at 10 kilometers. You know that how this is their health system decentralized and how they are, and even to rescue the drivers who are going 2 to 3 kilometers near the front line, bring the wounded back to the emergency. This is another from the Gaza, how the injuries in the war are there. And we just give you a glimpse that how the Palestinian people and the Israeli people, they are killing and injuring the people. Expression of good trade. Critical condition of the war used more expression, good traits such as self-confidence, mobility, ability, diligence, loyalty, precision, and concentration, courage, creativity, and wisdom in the healthcare provider. You can look how these beautiful skills are present not from the professional or the medical and surgery point of view. Wisdom, precision, concentration, courage, and health an informant said about the creativity of the medical. We frequently were out of enough dollars uh, to fix the neck of person affected by explosion waves. The collars were not there to fix the neck, so we decided to make them with styrofoam of the military equipment that were better than plastic collars and worked very well. You know how they have invented. The collars were made from the foam. A nurse aide noticed numerous martyrs and said, "This is important. Memoir spring houses means where the dead bodies and others were kept were full of the carcasses. Even there wasn't enough space for the family of Mrs. Deghan, one of the nurse that all members of her family were killed. So even that nurse with the family, all members killed, and there was no place to keep in the mortuary. Some ice slices were put around them to prevent the spread of bad smell, and person stood sentinel to keep the bodies away from the animal. You can understand, even the bodies were protected from the animal, the nurses' courage, family died, no place in the mortuary, but even then their courage and their memoirs are still shared with the world. So coming to the relationship therapy, this is a very new term. One of the important role of the workers, especially nurses, was psychological support of injuries to the families, The role became more difficult, especially when the wounded needed more complex treatment surgeries when they were involved in the complication leading to the serious charges. One of the difficulties that employed was the informing the family, the martyrs are injured warriors and psychological support of them. Some of the situation was so stressful for the medical team that could not be appropriately react appropriately reacted. However, they tried to use their previous experience and wisdom to manage such situations. You can see these are the different extended roles, caregiving role, the art and science of the nursing, set the goals and meet them. You can see that how a poor mother with a very old age reaching is met with a smile from the nurse side. Uh, Public health nurse has knowledge about the resources in her community, work in specific geographical area. The registered nurse is especially trained in community health. You know that they know the geography, they know the resources. Uh, Counselor, you can see these are the extended recognized choices and sense of therapeutic communication and skill, teach desired behavior, duties in wartime and battlefront. This is important, and the literature is said diagnosing, triage, emergency care, treating the casualties, battlefield, and sorting patient based on the severity, combat casualty care, working in advanced medical facilities, sea, shore, or in forward deployed field hospitals, evacuation, managing the transport of injured persons from battlefield, preventive medicine, monitoring the health of service members, even the doctors and the soldiers here in Iran, Pasdarane Inqilab, conducting sanitation checks and ensuring food and water safety, medical logistics supervision, supervising the procurement, storage, and distribution of medical supplies to the field units. One of the important World War II veteran observed of the military psychiatry, his patient is the army rather than the individual. This is the concept in the war. Indeed, the motto of the US Army Medical Corps is to conserve the fighting strength. They are more loyal toward the fighters rather than the patient. But in the Iran, we can see that it is a balance. They are looking after the community, villagers, cooperating, rescuing, treating, to act as a gatekeeper. The flow of injured or sick from uh, the cultural gap exists between the military and civilian, and some of the nations set up medical school for their armies. 1770, Peter the Great founded the Moscow Military Hospital, and even in you can see that the emergence of the medical army medical schools up to 1972, and the 700 hours longer than the most civilian medical schools, and includes tropical medicine, disease prevention, and field exercise. You can see that how they have changed the curriculum. So with this, we are ending. Please like Dr. Hussain Baksholachi YouTube channel. We have done this to give at least some kind of problem which we can also face, because we have also sensitive borders with Iran, India, Afghanistan, and even we are bordering the China, and we have Arabian Ocean, we have desert, and we are Asian nation. So anything which happens in the world affects us particularly, state of Hormuz. Hormuz is the lifeline for Pakistan also. With this, I think the Pakistani doctors can have a background knowledge that what is different from the normal and peace situation and war situation, and the medical resilience, and the one of the important punchline which I mentioned, that Iran has the strongest medical healthcare force, or healthcare force we call it, or human resources, one of the strongest in the world, and I think we salute, and we can learn from the Iran, not from the primary health care or usual health care, but from the battle care, and in wartime, how the health care can survive and reach to the excellence of its services. Dr. Hussain Bashpolachi, my YouTube channel link is there. Dr. Hussain Bashpolachi 6343. My email is there. Please drop comment, like, and press the button and share it, forward it. And this kind of information I am sharing because most of the information is coming about the economy, about the war, about the types of the missiles and nuclear danger, but public health is forgotten, and this was also forgotten in 1945 when UNO was created, but WHO was created in 1947 on 7th April after 3 years. So I want to highlight the situation of the Iranian people, and 1,300 to 1,500 casualties have occurred, and almost 1 million people are displaced, and about 100,000 have been in the shelters. So you can understand the healthcare challenge which the Iranian doctors they are facing. They are not appealing to anything. Red Cross is there, and the WHO, even the Dubai hub is not functional, and even the pharmaceutical companies and the drug supplies, they are not appropriately sympathetic to the Iran. So with this, Dr. Hussain Bolaji will appeal to the doctors of Pakistan that as a public health professional, any guidance, any support, or any kind of supplies we can send, because Prime Minister has already controlled and has shown the sympathy with the Irani people. So now the doors are open that we can support in the medical field, not in the political and war field. But if the injuries are there, some patients can be transferred to Pakistan, and we can also treat. Our contingent of the doctors and meet with the doctors of Iraq to improve the morale as a neighboring country. We are doctors and stand for the peace, and we will request all the foreign countries, USA, Israel, and Iran, solve their problem on the negotiating table. Nothing is impossible beyond the negotiation table. Wars will not solve the problem. Even First World War, Second World War, they could not solve the problem. How this war can be solutions for the problem. So political and economic interest can be solved through negotiation. And the public of the USA is also requested to be pressure, and public of all the GCC countries and even the Iran must move towards the peace front lines. Thank you very much, Dr. Hussain, for actually you today. This is 12th March 2026. I am from the Hyderabad, where even the Iranian feelings are directly reaching to our society in Pakistan. Thank you very much.